Today's episode, I want to talk about what is hospice and what services do they offer. A lot of people are really confused about what hospice really is, so I really wanted to kind of unpack that and explain everything about it so people can make the informed decision that they need to when they're dealing with looking at hospice and if it's right for them. I'm actually going to make this episode into two different episodes just because there's so much to it, especially when talking about the whole healthcare team and explaining everything about that. First of all, what is hospice? I know that I have discussed that in the two previous episodes, but I just want to do a quick recap on that. Hospice is a service that helps hospice patients live on their own terms. When you come onto hospice, you live life the way you want to live. It prioritizes comfort and quality of life over pain and suffering. Hospice does not prolong your life, but it also doesn't shorten it. And unfortunately, a lot of people think that hospice is a service that does shorten your life, but it absolutely does not. It just helps you live the best life that you can live up until you pass away. So that's exactly what hospice is. Now I want to start talking about the hospice team and each different piece of it and kind of what it does and what it does for the hospice patient. First of all, when it comes to supplies and things that hospice provides the patient. First of all, medications. Hospice pays for all medications that have to do with the actual diagnosis of the patient, and it also pays for all medications that have to do with any kind of comfort. So if you were to have COPD, it would pay for anything that has to do with breathing, anything with the lungs. Also would help pay for, or it would also provide anything that has to do with comfort. Sometimes when somebody is on medications to help with pain, they also become constipated. So then you would have to have medications to kind of help with constipation. Any medications that helped with pain, shortness of breath, any kind of wound medications, anything like that. So anything that has to do with anxiety, somebody with COPD is absolutely going to have anxiety just because of the breathing issues. So it's all included in what hospice pays for. And a lot of those medications actually get sent right to the home. So it's a really kind of easy process to get those medications. The next thing is any medical equipment such as a hospital bed, an oversized bed table, oxygen supplies, whether it be an oxygen concentrator or the actual bottles that a patient may need, like if they wanted to go outside, any kind of wheelchairs for a patient to be able to go out or move around, rollators, walkers, anything that helps that patient. Bedside commode. If a patient becomes incontinent, it would pay for briefs, wipes, any kind of creams. Wound care supplies, if somebody's having some wounds, it would provide all of that. Next, I would like to talk about the hospice care team. I'm going to kind of start at the top and work our way down. First on the list would be the hospice medical director or the patient's primary caregiver. Now, when somebody comes on to hospice, they have choice of who they want their primary doctor to be. They may have had a doctor that has been following them for 30 years and now they've been put on hospice and they don't want to leave their doctor anymore. Well, they can do that if they would like to. But some actual primary care physicians they're not comfortable with hospice, with the medications and just how we treat hospice patients. So sometimes they don't want to be the hospice doctor for that patient. So there's always another option for that patient. The hospice medical director or one of the hospice physicians can be their primary from that point on. Now, sometimes the primary care physician that the patient had recently still would like to know information about their patient, but they're not actually prescribing medications and managing the patients. So sometimes they're just not comfortable with that, but we will continue to update them if that's what they want. Next, I'm going to talk about the nursing staff. Now, every hospice patient is assigned a primary nurse. That nurse is their care manager, who pretty much is in the center of all the care for the patient. They are the ones that contact the doctor when they need medication changes or plan of care changes. They are the one that orchestrates that. Just make sure that everything is running the way it's supposed to be running. They will usually see patients 1 to 2 times a week, depending on the patient's needs. Some patients will only want to be seen once a week. They get a full assessment by the nurse. They talk about, goals of care. They will go over the plan of care, and then they will collaborate with the doctor about the patient and discuss any plan of care changes that you need to be made. So that nurse will be the primary contact for that patient and family. Next, I want to talk about the social worker. They see the patient 1 to 4 times a month. All just depends, again, on what the patient needs. They will be there to help with certain things like any kind of emotional needs for the patient and the family, not just for the patient. That family also needs a lot of support, especially socially during that time. They can offer any kind of, if there's any like financial issues, they can help with financial resources, any kind of advanced directives for that patient. If the patient hasn't filled out an advanced directive form to kind of explain what their wishes are near end of life, the social worker can help with that too. Any kind of final arrangements. Sometimes the families are lost when it comes to, making funeral arrangements, choosing funeral homes. So sometimes just having that person by their side to kind of help them navigate that is very, very helpful. So leaning on that social worker is very, very important, especially for the families. And then if long-term care placement is needed, the social worker can help with that too. So they can help get a patient placed into long-term care if, as that patient declines, the family realizes that they just don't feel that they can take care of that patient the way the patient needs to be taken care of. So then the social worker can help with that. So again, that's 1 to 4 times a month, just depending on the patient and family needs. Next, I want to talk about Hospice Aids. Hospice Aids are very beneficial to the patient and the family. They can come into the home 1 to 3 times a week and help with bathing, help changing sheets, cleaning up the area around the bed. Families love their aids. They are so helpful for them. Sometimes as time goes on and the patient is declining and caregiving needs become greater and greater, that aid is a godsend. Chaplains. Chaplains is another service that hospices offer. They can come into the home 1 to 4 times a month also and are there for spiritual needs for that family. They will think the chaplain is going to be there just for Christian needs, but that's not true. Chaplains in hospice are trained to meet families and patients where they are. It does not matter your denomination. That chaplain will meet you where you are and help with your spiritual needs where you are, not where they are. They're not going to try to turn you around to the Christian faith or anything like that. It's strictly for you and what you need and what the hospice patient needs and what the family needs at that time. So just know that. And volunteers. Volunteers are individuals that have volunteered to work with hospice, and they can come into the home 1 to 4 times a month and sit with the patient. If the families have errands that they need to run and they can't leave their loved one alone, a volunteer can come and sit with the patient. And some volunteers are just to sit there with the patient and, in case anything were to happen. But some actually will do a little bit more. They can help change briefs. They can help move the patient from like chair to bed and back and forth. So it depends on what that volunteer can do. So, and volunteers will be paired up with families and patients just depending on the needs of that patient and what the volunteer can do. So I had a husband once that could not leave his wife. She was completely bedbound at the time. And once a week, a volunteer would come in for 4 hours. It would allow him to get his errands run, grocery shopping every week. That volunteer came just specifically for those reasons, and he knew that during that 4-hour span, he could get everything he needed to get done during the week. So then the rest of the time he could spend with his wife. So they're very, very helpful. So those are all of the hospice team members that definitely come with hospice. It's mandated by Medicare. But then there are some complementary services that some hospices, I know that my hospice that I work for does provide these services. I'm not sure if all of them do. So I would always ask if those services are something that you would really want. Massage therapy is a service that some hospices will offer. Hospice, you wouldn't think, oh, massage therapist would come into the home, but they do, and they help with pain control. They can help with fluid balance. Sometimes if somebody becomes very edematous in the extremity, sometimes just working on those areas by the masseuse will help kind of alleviate some pain and pressure and everything with that. So they could be very, very beneficial. And then just great for relaxation. When a hospice patient's going through all of this, it's a very, very stressful time. And it can just really help kind of relax the patient, which then in turn helps with pain control. So it all kind of works together. Music therapy is something that hospices can offer. They can offer harp, guitar. We actually in my hospice have harps and guitars for relaxation. And sometimes spiritual reasons. The harpist can play religious songs, and this has happened actually several times that I know of, that while the harpist was playing, the patient was so relaxed and so spiritual that they actually passed away while the harpist was playing. So it just kind of helped them let go. So it was very beneficial for that patient. And then pet therapy. There are some hospices that have pet therapy to where pets can come and spend some time with the patients. And it's amazing what animals can do to help alleviate stress and anxiety. So that can be very beneficial also. Physical therapy is something that can be offered. It really does help. People would think, oh, you don't need that at the end of life, but actually it kind of can help, with some of the hospice patients that have a lot longer to go and they're more mobile. It can help reduce falls because that person is stronger and can move from like bed to chair, and it just kind of helps with those skills. Sometimes a physical therapist can come into a home and kind of look at it and see, what are some reasons why this patient could be falling a lot. So it can really they're kind of trained to do that and look at the surrounding area and think this needs to be changed because this could be why, maybe that rug right there is why this patient is falling so much. So that could be very beneficial also. And then last, grief support. Grief support is very, very important, and that is actually for the family. After the patient passes away, the family is still part of the hospice family, and hospice will surround that family. They offer counseling both in home and out of home. They can offer phone support if needed, if a family member doesn't want to come into the office. They also offer services for children, camps to help with bereavement support. Children just can't bring it out on their own, but some bereavement counselors are very skilled at games and things that can help a child get out those feelings. So there are camps available. The camps that my hospice that I work for offers, it's not actually just for hospice patients. It's for community also. Any children that have lost loved ones that were close to them that they're having trouble dealing with. So that's very helpful. And then community support groups. You don't have to be a previous hospice family to go to a community support group. Everybody is invited to come to these groups because we want to help everyone, not just hospice patients' families. Now that we've talked about the individuals in the hospice team that circle the patient and the family, next we're going to talk about what services do hospices offer. So we'll see you next time.